A new study published today in the British Medical Journal is refuting the time-honored practice of restricting pregnant women from eating before they enter the delivery room, going so far as to tout the possible benefits of actually eating during labor. Joining us to talk about this is Dr. Jacques Moritz, Director of Gynecology at St. Luke's Roosevelt Hospital in New York City. Dr. Moritz, thanks so much for joining us.
Hi, Tanya.
So tell us a little bit, first of all, why guidelines in the first place were set that restricted women from eating during labor.
Well, it made a big switch, because first you could eat in labor, and then all of a sudden you couldn't. And it wasn't the OBs. So out there, women, it's not me. It's the anesthesiologist. This is all coming from them. They are terrified, and so are we, but they're terrified that somebody can, what they call, aspirate. That if somebody needs an emergency C-section, that they can aspirate whatever in their stomach. And when you're pregnant, your stomach just doesn't digest very well, and everything kind of sits in it. So they're worried that when they have to give this emergency anesthesia, that everything's going to come up.
So the original guidelines were only in case of an emergency C-section.
That's right.
Okay.
But you had a child, and the way they treat everybody is everyone's a potential emergency waiting to happen.
Right.
Now, I think we need some sensibility in this, and I was speaking with some anesthesiologists yesterday, and they're still as strict as they ever were. So, you know, this study said there's really no difference whether you eat or whether you don't. Everything kind of turns out okay.
But doctor, what I want to know,
Right.
as a mother who's gone through labor twice,
Right.
I can't tell you, food is the last thing on your mind when you're going through labor. So who would benefit from eating? Who would even want to eat during labor?
Well, I've never had a child, but I've taken a lot of people through it. But I have run a marathon. It's kind of the same thing. You don't want to eat when you're running a marathon. And you're right, Tanya. When you were having your baby, the last thing you would think about is a Big Mac.
Absolutely.
Right. But I think there's a couple things. You know, a lot of people aren't being induced, and these things last forever. And when you walk into someplace and you're told, this is what you can't do, that's what you want to do. So the minute you come into the hospital, you say, okay, you can't eat, you can't drink, and you can't do this. And all of a sudden you say, my God, I'm hungry. You probably weren't even before. Nobody is hungry in active labor, all right? And the first instinct during transition, if you're doing it without an epidural, is to, right, is the body gets rid of everything's inside, because you're ready to go through 2 hours of hell, which is pushing.
Yes, I have to confess, I was told to eat a little something before going to the hospital because labor could be very long.
Exactly.
So I did. I forced myself to eat something, and you're right, as soon as labor started, I hate to say it, but that food did not stay in my stomach.
It doesn't, and it's a good thing it doesn't. And when you do very strenuous activity, like if you go to a gym and you get one of these brutal trainers, they say, oh, I'm going to make you vomit at the end of the day. And the problem is that they're really bringing you to like your ultimate point. And that's what labor is all about. You know, if you're doing it natural without an epidural and all that, that last couple hours are rough.
So who would benefit then from eating something?
Okay, I think that people that would benefit from this are these long inductions where they come in with this 24 hours of what we call Cervidil to ripen the cervix. There's nothing going on. I mean, you may as well have something to eat. The chance of the old-fashioned classical emergency C-section with an endotracheal tube is 1 in our hospital. We do 6,000 deliveries. 1 out of 6,000. So, you know, I don't think it's really fair to cause 6,000 women not to have something to eat or drink for that chance. That's kind of silly.
And so is it on the rise then? Are more women starting to eat something during labor?
I think the ones in this long labor are doing what you do. They can eat at home. A lot of them are sneaking it underneath their beds. And we don't want that kind of attitude that you have to sneak and all that. You do have some patients that are out of their minds, though, and you know they come in with a whole delicatessen full of food with the corned beef and sandwich, and and you look at them and say, "Come on, you know that's all going to be coming up in a couple of hours. You may not want to eat that. Oh, I'm hungry."
Right.
So, okay, you'll find out. So
they have to go through their own process.
They have to learn on their own.
So this is likely not something that's going to take off like wildfire. There may be some women who decide to eat a little something, but this isn't going to be the next trend in childbirth.
I don't think so. I think because when you come into the hospital with all the rules and regulations and bring this article out and say, look, it's okay, the anesthesiologist say, that's fine. I just won't give you an epidural. You can do whatever you want.
Right. Oh, so if you do eat something, then you're not going to be allowed to have an epidural.
No, you can't have an epidural.
Okay.
But I wouldn't bring in food and tell the anesthesiologist I can do this, because they can easily say, you know what, I'm just not going to go along for it.
That's something very important to keep in mind. A lot of women out there, if you're thinking about that epidural, remember your anesthesiologist.
That's right. You need that anesthesiologist.
He's your best friend.
Right.
You don't want to
and you know, you have to understand, OBs and anesthesia, we usually work together, but you know, I was in a fight with one a couple days ago because for an elective C-section, you can understand that, you know, eating a large meal is not that. But every hospital has its own little rules. Some will let you have ice chips. And this study said the same thing. Some will let you have sports drinks. Some will let you have light food. So everybody's different. So women out there watching, find out about this before you check in.
But liquids, like you said, are always fine.
I feel that liquids are fine, right?
Even black coffee, tea.
Black coffee, but they're sticklers on if you put milk in it. Right. Why? Because the milk can curdle and the milk can come up.
Right.
Personally, I think that's a little excessive, but again, I need them to do my job.
Bottom line is check with your doctor, check with your anesthesiologist.
Right. And your hospital policy,
and
find out what it is.
Hospital policy, find out whether or not you can or want to eat. And for more on the debate over food and childbirth, check out the health page at abcnews.com for an article capturing the whole story.